name is Kelsy Hinton. My student ID number is 320-1345, and this is my video submission for my surgical and anesthesia class. Okay, I'm going to go over admission forms. So the left-hand side has the coat, your eyes, your ears, your nose and throat, mouth, and all the way down to heart and lungs, your abdomen, your weight, whether it is normal or abnormal, the date, the patient's name, their account number, last name, breed, color, date of birth, and the sex. Okay, so this is a permanent record for a client, and this shows everything like Theodore's visit. Every time he has come in, we have every one of these pages in here from when he was very first brought in. That was his first visit. Okay, so on your release and consent forms, our clinic does like surgical and anesthesia. If the animal is coming in for a spay, then we have an anesthesia form that has all of the client's information and all of the patient's information, and it has a little blurb about the owner consenting to sedate the animal. These are the two main forms that we use in our clinic. I'll show you a cage card now. So our cage cards have the animal's name, they're a male or a female, the description of them. We need to know what breed of animal it is, whether it's a domestic medium hair or an Australian Shepherd, whatever it is, we need to know when they came in and when they plan on leaving. If you're not sure on the leaving date, you can put a question mark, no big deal. The owner's name, their daytime phone, like their cell phone, and then their emergency phone. What they're in for, if it's a surgery, when the surgery is scheduled, or their dental work, and when the vaccines are given. And then you have options here to check them, but the special instructions is where we put like the surgery for don't feed or water that day, or like boarding. We tape them, or we stick them onto this cage card. Is a complete blood count. It has the day we drew the sample and the time, and the client's account number, the doctor, which is just Dr. Lindley's initials, the patient, the age, whether they are spayed, neutered, or just male or female in this species, and then the test date. So it has all of your white blood cells, your red blood cells, all the way down even to your platelets. Discharge instructions. Okay, so when the client comes to pick up their animal, we tell them to watch for any redness, oozing, or swelling around their incision site, depending on what their surgery is. If we did a dental, watch for any tenderness or excess bleeding. And then like on a spay upkeep, we ask that they keep their incision line clean with hydrogen peroxide twice a day. And then we send home little packets of triple antibiotic ointment. We ask that you put it on there twice a day. Just dab it on with a little Q-tip or a cotton ball. So have them come back in 7 to 10 days, depending on what procedure it is, to have staples or sutures removed. If it's a big procedure like a tail dock procedure or an abdominal surgery, we usually keep them in till 14 days or so. It depends on Dr. Lindley's preference. And then we send home pain medication. We don't want the baby to hurt, and we don't want the owner to worry. Normally we send home carprofen, but carprofen or Metacam to help with pain. It's a once-a-day tablet, so it's easy for owners to do. If we send home an antibiotic, we usually send home sulfaxin with our spays that are that were in heat when we spayed them. How to properly restrain an animal to draw blood from their jugular vein. You can hold their head up just like this and shave the neck area. That way the doctor or the technician has proper space and can see the vein clearly. You just hold their head up and make sure that they are stable and not able to wiggle around. How to draw a blood sample from the cephalic vein. That is your front legs here. You're going to hold their head over here. That way, in case you have an aggressive animal, they won't be able to bite. You hold their head here. You apply pressure underneath their elbow. Put pressure on top of their leg and roll outward. That way you can see the vein and it's easier to draw on. Okay, to draw blood for the saphenous vein, you're going to hold your animal on the side and you're going to apply pressure to, you may have to have the person drawing the blood pull their leg out, and then apply pressure or a tourniquet. That way you occlude the vein that's here. This is how to get a patient in and out of a kennel safely. She's super excited, I know, hi. So you want to make sure that you grab them with both hands and you have complete control over getting them out of the kennel. This is how to properly put an animal back into their kennel safely. You're going to use both hands and put them in, and then make sure you get your kennel door closed completely. And then we latch the kennel doors with a hook. That way they cannot pull on the door and get out or jump out. How to properly remove a feline from a kennel. You want to grab them with both hands before pulling them out of the kennel. And most times you have to grab the feline by their scruff. It does not hurt. It's the way that their mom, it's an instinct they know because their mom used to carry them around like this and she made them be still so that she could move them places. Now how to insert him back into the kennel is keep his scruff and insert him into the kennel with both hands. Make sure he's all the way in and then shut the door and again apply the lock. This is how to safely apply a muzzle on a canine. Typically you want to come from behind. Their head will usually be facing away from you. You want to come from behind, Heidi, stay there, and apply over the snout like this. And then you will clasp from behind and tighten down. And that is how to safely apply a muzzle. This is how to correctly apply an Elizabethan collar. What you want to do is slip the e-collar over their head. No, baby. And then you want to tighten this down and tie it. We always recommend tying it over a collar. That way they do not slip out of it. You want it tight enough that their head can't come out of it, but that they can still breathe. This is how to do a proper physical before any like surgery or when you do shots or anything. You're gonna go from the snout all the way to the tail. But we want to make sure that we do her temperature, her weight, and her respiratory rate. So let's start with her weight. I have a scale behind me. And we have her whole physical form. Stand here, Heidi girl. She's stay right there, Heidi. She's 13 pounds, 15 ounces. So we will write that down on her physical form here. And then we will go ahead and get her temperature. I have a thermometer ready here. I know, Heidi girl. You're okay. Hey, Heidi. You're just not gonna do this? Is that what we're gonna do? Heidi. Here we go. I may have to edit some of that out. And it's reading at 1014. Normal for dogs is 1015. So she is good there. You bunched this all up. We'll record that. eats heals science diet. Okay, now we will go ahead and listen to her on her heart. You want to start out on the left side. We will listen to the left, the right, and then her lungs, and make sure that there are no abnormalities, there's no heart murmurs or anything like that. When you're listening to her heart, you're going to count for 60 seconds how many beats you hear, and then you're going to double it. So, do you need to see this first? Okay, let's listen. Oh, goodness. Okay. Her heartbeat is good. She does have a slight heart murmur on the left side, so I will make note of that. Her rate is about 120. Listen to her lungs. We are listening for any wheezing or congestion that we can hear if she has any. She's fairly healthy, so I don't think she will, but no, she's golden. You'll want to check her mucous membranes. That's how quick the color comes back on her gums, and that is about 2. And then the rate, if it comes back normal, you're going to put W and L, and that means within normal limits. We're going to do the rest of her physical. We're going to go through and check her coat and her skin. Everything appears normal there. Her eyes, she's getting slight cataracts, so we need to make note of that. If she had any discharge or she was squinting or anything like that, we would need to put that on there. We'll circle the cataracts. We'll check her ears. If they are really dirty and infected or really red, you want to get your otoscope and check down in there. But her ears look perfectly normal. There's not even any dirt in there. So you'll want to check her nose and her throat. Yeah. When you're checking for her throat, you just want to make sure that there's not any phlegm. You also want to check her lymph nodes, which are below her jawline here. And all of that is normal. You'll want to check her mouth, her gums, and you're going to want to check all of those teeth. If she had any tartar or any broken teeth or her gums were inflamed, we would need to note that, but she does not. Her legs and her paws look good. Her abdomen, you want to note that she does have a small mass here on her belly, but everything else feels great. Okay, to assign Heidi an ASA grade, it is rated from 1 to 5. 1 is completely normal, 5 is on the verge of death. She's completely healthy. She doesn't have a fever. Though she has a slight heart murmur, it's not huge. She's not overweight, so I'm going to say she is a 1, a class 1 ASA grade. This is how to do a complete physical on a feline. I have Samara here ready for a physical. We are going to focus mainly on her temperature, her weight, her respiratory count. We're going to start with her weight. Hi. You're so good. You are. You see here. She is 7 pounds, 3 ounces. We will write that on her physical form here. 7 pounds, 3 ounces. She eats Hill Science diet. Dry. We're going to get a temperature on her. Though she is friendly, this part may be a little bit stressful to her. So what you're going to do is hold her tail and scruff her. I know. Though it's a fast thermometer, it started out at 90. So we're climbing slowly. I know, Miss Samara. I can let your tail go. Oh. She is at 100.2. So I will write that down. We'll now listen to her heart. It is obvious that she does have some kind of wheezing going on. That was gross. That's why I picked her, so that we could probably get her started on medication and run the necessary blood work that we're going to need to do. So we're going to start on her left side. You're so good. Her heart is racing, but I think she's excited to be in here. It appears normal, so we are going to put appears normal. It is slightly fast at 140. And now we will listen to her lungs. What we're listening for is wheezing, congestion, which I bet she has some. If it is hard to hear because she is purring, I will need to note that. Okay, listen to your lungs. We'll start out on the left side again. She is purring really hard, so it's really hard to hear. From what I can tell, I can't hear any kind of congestion, but it is obvious that she does have some. Now we will start the rest of her physical. We'll start with her coat, which looks good. She's got a little bit of dandruff, but she is an outside cat, so that's okay. Hi, baby. I know, you're so excited. Oh, okay, you're gonna help me? Thank you. Her eyes have a slight discharge on the left side here. Let's see your ears. Her ears are slightly dirty, so we will note that and we will get them cleaned out. Her nose is obviously very, very snotty and has some discharge in it. We will need to do that. Can you see your throat? Yeah, you look good, babe. Her legs and paws appear to be working well. How's your abdomen feel? Yeah. And her weight is good. I will suggest to Dr. Lindley that we do run blood work on her, though, since she is snotty and congested sounding. We'll probably need to run a complete blood count, a chemistry to check her liver and her kidneys and her blood glucose. And then I would also recommend doing a feline SNAP triple, which tests for heartworms, the feline leukemia, and then feline immunodeficiency virus. And then on an ASA grade, she's healthy otherwise besides the nasal discharge, so I'd probably give her a 2 on her ASA grade. I am here with my preceptor, Jessica, and I'm going to draw from the jugular vein of a canine. Yes, I'm going to make sure that the needle is beveled up. And then, do you want it for Kim? Oh, you want to apply a little bit of pressure to make sure that he does not continue bleeding afterwards. And that's how you draw from the jugular vein. You're going to draw off the cephalic vein of a canine. She's going to hold it off, depending on if you have help or not, or if it's a harder stick, will be dependent upon whether you want a tourniquet or not. So you want to make sure that the needle is beveled up. And that is how you draw from a cephalic vein. We are going to do a lateral saphenous blood draw. So you want to clean the area, and then you're going to go bevel up. Let go. Beautiful. And that is how you draw from the saphenous lateral vein.
Patience is a virtue. You just won't believe it.
Golden? Okay. And that is how you draw blood from the jugular vein of a cat. Yay! That's how you draw blood on a cephalic vein of a cat. We shaved the leg. That way we can fill the vein good. Cleaning it with iodine. And then go over it with alcohol. I have a TB syringe. Got it. And that is how you draw blood on a cephalic vein. How you draw blood on a saphenous vein of a cat. You're going to clean the area with iodine. And then go back over it with an alcohol cotton ball. I'm going to go with the needle bevel up. Oh, there we go. Okay. And that's how you draw blood on a saphenous vein. Okay, so minimum database for young, healthy surgical candidates. There's 5 different things. Your first is your packed cell volume. This is your hematocrit that you'll test. The normal for dogs is 37 to 54%, and normal for cats is 27 to 48%. The second database that you're going to use is going to be your total solids or your total proteins, or also known as TS or TP. This provides info on animals' plasma protein levels. The 3 major plasma proteins are albumin, globulin, and fibrinogen. And the normal range for the total solids is, for a dog, it's 5.5 to 7.5, and for a cat, it is 6.5 to 8.2. Now, your third database test is your blood glucose. This indicates the carbohydrates, metabolism, and measures the endocrine function in the pancreas. So for dogs, it's going to be 80 to 130 mg per deciliter, and for cats, it's going to be 70 to 180 mg per deciliter. So on your, oh sorry, it nearly fell. Fourth minimum database, it's going to be your blood urea nitrogen, or your BUN. This will show up on your chemistries as well, but the BUN levels are used to elevate the kidney's ability to remove the nitrogenous waste from your patient's blood. So for a dog, it's going to be, normal levels is going to be 5 to 35 mg per deciliters, and the same with cats, 5 to 35 mg per deciliters. Your fifth minimum database test is going to be your ALT, which is alanine aminotransferase. Yes. Okay. ALT is an enzyme that's found in high concentration in the liver cells. So for dogs, it's going to be 8.2 to 109 units per liter. For cats, it's going to be 2.5, it's going to be 25 to 97 units per liter. Additional tests to run if you find abnormalities in your physical exam would be your complete blood count, which would show your white blood cells, your red blood cells, all the way through to your platelets and more. Then you could run a blood chemistry, which would show your liver functions, your kidney functions, and your blood glucose will be on there. You could run a clot factor test if the gums are pale, if they're weak. You could do a thyroid test if your patient's belly is black and they're showing more symptoms of a thyroid patient, like hair loss. And you could also do blood smears. Our doctor does lots of blood smears and sends them off to the TVML labs. You could do a urinalysis if there's frequent urination or barely any urination. You could do your ECG, radiographs, ultrasounds. If you have a puppy that's coming in that's throwing up or has diarrhea, you could do a parasite test, also known as a fecal test. You could also do heartworm test or canine snaps on dogs, which the snap includes a heartworm flag and 3 types of tick fever. And another test you could run would be feline snap triple, which would include your heartworm and your feline leukemia and feline immunodeficiency virus. To decide what pre-anesthetic, anesthetic that you need to give, a lot of it's going to go based on your doctor's preference, but also the weight, the age, and the condition of the animal. How to complete a drug entry. First, let me show you our spreadsheet that calculates for canines what drug to give. Okay, so on the computer, you have the patient's name, the date, what their weight is. Oh, I forgot to touch screen. What their date is, or what their weight is. It'll calculate everything here. Let me change it to something different so you can see. It calculates everything in this side column. So I went ahead and printed it out. Kirby's here. He's 25.6 pounds. Dr. Lindley likes to use the butorphanol, which is torbagesic, and dextromethorphan. So if you come all the way out here, it's a dose per pound, and then dose per kilogram, and then the actual dose. So what we would give is 0.1 and 0.3, because you would round it up. So the butorphanol is the one that we would write in our drug book, in our drug log, which I will put here. And what you do is you put down the date, the owner's name, whether it's a feline or canine, the patient's name, the procedure, and then you find which drug that you're using. There's ketamine, torbagesic, diazepam, phenobarb, morphine, buprenorphine, tramadol, euthanasia, and then we put the initial beside it. So we're using torb, so we'll do 0.3, then you initial it. So then every 3 months we count our control drugs, and then we log it into our control drug book. We are going to talk about our anesthesia machine. So over here is our oxygen tank. We have our tank pressure and our line pressure. The line connects all the way to here into the back of the machine, into our flow meter here. We have our flow meter, our flush valve. This is our vaporizer, our soda lime container. We have the screw here that will undo the soda lime canister. Back here is our relief pressure valve, and it connects to our waste container, which is down here. Yeah, I know. So, and then we have our tubes. This is our exhale tube and our inhale tube on our non-rebreathing machine. So when you are hooked up to an animal, you will have a mask. Let me get a better one. Depending on the size of your patient, well, technically, since it's a small bag, you would have a smaller animal hooked up to it. You hook it up, you would stick their muzzle into here. This would be for like very, very little patients. And then we can move up to big dogs and medium-sized dogs. And then you would change your bag and your tubing accordingly. For anything under 15 pounds, it needs to be this little tube. For anything over 15 pounds, you need a much larger tube. Induction chamber could be used for very angry cats or little dogs that need to be sedated. What you do, if you have just a tiny patient, you can divide this induction chamber in half. That way they only get half. The air only goes to half of it. Otherwise, you could leave it completely open. And you'll put your patient in there. You will turn on your oxygen, your isoflurane. You'll make sure that your flow meter is up. Okay, so how to hook up the induction chamber. You're going to make sure that your hoses are good and tight. You'll add this little adapter piece and you will hook it on to either one of these. That way the gas and the oxygen flow in and then it can flow out. And that is how you use an induction chamber. Check a pulse oximeter. We have an older school one, but we don't use it as often. All you do is hook this piece to part of the flesh, so either the dog's ear or the dog's tongue. You'll turn it on and it will monitor through surgery. What we actually use a lot is a newer version of this. It has an ECG recorder. It has your pulse oximeter and your thermometer, and you can do a daily check. And then it has how you can review everything that you just saw. So on the leads, what you will do is attach this piece to a dog's tongue, a dog's ear, or even a cat, or their tail, depending on where your procedure is, depending on if they are intubated or not. And then you have two cords for your ECG part. They are labeled left and right, and you attach it to the front armpit of the dog and then spray with alcohol. An esophagus stethoscope, our clinic does not have one, but what you do is insert it into the dog and you can have it amplified through the room, or one person can have an earpiece and only hear it. But if you amplify it through the room, everybody can hear it, the doctor can hear it, and you can monitor that way. Okay. Brachycephalic dogs tend to have smaller tracheas. Even the cats do as well. So you need to take that into consideration compared to your mesophilic dogs who have normal size trachea. We have a system where we base it on weight. This is a size 6 trach tube. This would be for roughly 10 pounds of the dog. You have where it connects to your oxygen and your gas. Your tube will go down the trach, and then you have a cuff here that you will inflate to make sure that you have covered all areas. That way, if a dog or a cat is to throw up, it goes through that tube and out, and they do not choke. Okay, respiratory monitor can be determined by the technician watching the patient's chest movement. And you can watch the reservoir bag as well, but you watch the movement of the chest for 15 seconds, and then you multiply it by 4 to calculate the breaths per minute. A dog or a cat on a surgical plane has a rate of 8 to 20 breaths per minute, and if it's under 8, you have a cause for concern. That may be that your patient is too far under with the anesthetic gases and you need to turn it lower. Okay, so this is our blood pressure monitor. What you do is connect this hose to the back of the machine here, and it snaps in. That's how you know it's connected. You will pick either a dog or a cat, and what you will do is there are several different cuffs in here, and you will base it on the size of the dog's leg. You're going to place the cuff on here, let's see. There is a spot that says artery. This is where your main vein is in the leg, and it needs to be on that piece. Not too tight, but not too loose. Okay, you'll want to hold your patient still. You've got your monitor on, and you will hit start, and you hold out their paw, and it will test their, or take their blood pressure. I can let you on the floor. What you want to do is unwrap your patient, and I will show you the screen. And put this here. Perfect. So it's showing here, she has 70 beats per minute heartbeat rate, so it's really low, but she is sleepy and it's kind of late. And this is her blood pressure. Thermometers, so we use a digital thermometer here at the clinic. It works pretty fast, which is helpful if you have a upset animal, upset patient. They work quickly. Normal for dogs and cats is 1015. Anything above that is a cause for concern. What you do is we put a little bit of lube on the end of the thermometer, and then we put it in their rectum and let it do its thing. This is my preceptor, Jessica. She has been helping me along the way, and she's going to help me today, showing the IV catheter placement. So first, you're going to want to shave the leg of choice. I'm sorry, bird. You're going to want to make sure you get all the hair off, and then you're going to want to clean it with an iodine scrub. Oops. You just want to make sure that the area is clean. You're going to want to go in with a alcohol swab and make the area ready for the IV catheter. Okay. If you cannot hold off, by the tourniquet up above the elbow. That way we can get good vein. Get good vein. I have my IV catheter and then the plug for it. Okay, you're going to want to go bevel up. Once you have a flash of blood, you're going to slide the catheter in and then pull back on this. Pull back on this. You're going to take the tourniquet off. Oh gosh. And apply this. Oh no, I hit it. You're going to tighten this on. This is just to stop the area of blood to tape in. You're going to use a 1/2 inch tape first. If you don't have 1/2 inch tape, then you can rip the 1 inch tape in half. Okay. And you're going to want to make sure that everything stays in place. It's a delicate part. You're going to go all the way up. If you don't get it tight enough, there's no point in even having the catheter because they're going to get it out. So you want to make sure that the tape is good in place and tight, not loose. Okay? Then we're going to follow up with another 1/2 inch piece of tape. And we'll make sure that the plug is nice and tight, which it is. And then you're going to want to go directly up against the other piece of tape. And then you'll add the 1 inch piece of tape. These all need to be about the same length across the top of both pieces of tape. I'm going to do a lateral saphenous IV catheter. I'm going to prep the area first. We are going to scrub her IV site with iodine 3 times and then go over it with alcohol. And we're going to apply the tourniquet. I have a 24 gauge IV catheter. I've got my cotton ball with alcohol on it. Rub the area. You want to make sure your bevel's up on your catheter. Okay. So if she's going to let off the tourniquet, her preceptor is, then I will pull out once we get the IV fluid started. She's actually getting a dental done today. She has some really, really bad teeth. To know whether it's patent or not will be whether it bloods.
Yes. If you hold the lid.
Yep. We're going to tape in and secure it with 1/2-inch tape first, and then we will go to 1-inch tape over the top after we do 2 1/2-inch tapes. And then you can secure it with vet wrap, but since we were doing a dental on her, I want to make sure that we can get to the IV if needed quickly. And you want to make sure that it is screwed all the way in when taping in. Yeah, a little hawk. Okay, golden. To do a subcutaneous injection, we're going to give this cat his meloxicam. Let me turn it around better. For his pain medicine from his neuter. Okay, so you're going to want to insert the needle and just go directly under the skin. And then for an intramuscular injection, you're going to want to go directly into the muscle. This is just saline solution. You go directly into the muscle and inject. This is how you inject intravenous. Yeah. Okay. So I just have saline solution in my syringe. What you're going to want to do is insert the needle with the bevel up. You're going to want to insert and then pull back on your syringe to make sure you know you're in, and then have the person let up and just inject slowly and apply a little pressure so he doesn't bleed. We are pre-oxygenating our little neuter here. We are doing this for 10 minutes and then we will start his anesthesia process. Doing his anesthesia induction, we are going to give dextromethorphan and butorphanol. Since he is little bitty, he's only 6 pounds. You're going to give it intramuscular into the meaty portion of his little thigh. Give me your arm. Thanks. Oh, he's stickers. Oh, goodness. Oh, and then we will follow up with isoflurane gas when he is on the table. Okay.
She's gonna do that. She's gonna. There you go. Okay, you're good.
Okay. Take this part out.
Yep.
Okay.
Take your scope out. Alright. just quit.
Is applying eye lube so they don't have dry eyes, and you will cause a corneal ulcer if you do not give this. To palpate a urinary bladder, it's going to be lower at the bottom. It's kind of like an orange. You'll apply pressure to express it. Properly clip and prep for surgery, you're going to want to make sure that you shave for a spay all the way up to their xiphoid process, which is the bottom of their rib cage here. And you'll want to get all the hair away so that the surgical site will be sterile. So right now we're clipping the hair off, and then we will vacuum it off to make sure all the hair is gone. And you're only wanting to use surgical clippers, not something that you would clean ears with or something like that. We're going to make sure that we do one scrub in here, and then we will do more in the surgery room. The hair is away from the surgical area. And then we have iodine in here, and you're going to want to go down the middle and then go around the sides. You're going to want to do that about 3 times before you take your surgical patient in there. Now we're going to show you how to safely move a patient using a gurney, which will be a towel here. You have to be careful not to contaminate your surgical site. And my preceptor Jessica is going to help me.
So do you go before me?
Yes. Right way. Okay, so to keep a record during surgery, you can just go. Our temperature, every 15 minutes, we don't have a thermometer that stays in during surgery. So we take it every 15 minutes, and the rest of the vital signs every 5 minutes. So I will go ahead and do the temperature. And you want to make sure that you don't get in the way. Yeah. It started out at 93, but it's a fast thermometer, thankfully. So normal for cats and dogs is 101.5. It'll be slightly lower when they are sedated. She is at 99.7. Her monitor is reading 88 to 90 heartbeat. Beats per minute. So I will write that on here, and then we'll also do direct contact to confirm. Okay, we are good, and I will continue monitoring her temperature and the rest of her vital signs through her surgery. How to demonstrate CPR on a patient. What you want is 3 to 5 people helping, one doing compressions, one getting the trach tube in, one doing your ambu bag, one checking vitals. So what you want to do is on both sides of the heart, you're going to want to do compressions to try and get the heart to pump on its own. And hopefully by the time that they get, hopefully you can get the heart to go. But if not, this is an ambu bag. You would hook it up to their muzzle, and you would hopefully by now you'd have the trach tube in. You would hook this piece into the oxygen, and it would give oxygen directly to your patient. You can let her up. Okay, this is how to properly scrub in for a surgical procedure. You're going to need your hand scrub, your face mask, your hairnet, and then your gown and your drape will be in there. So you're going to want to start by opening up your gown. So you're going to open up your gown like so. And then you're going to want to dump your gloves onto it. You're going to make sure all your jewelry's off. And then you're going to put on your face mask and your hairnet first. You want to make sure all of your hair is tucked in. And then we will begin scrubbing. Okay, so you're going to begin by doing the tips of your fingers first. You're going to do it 10 times, and then we're going to move down the sides of our fingers. Okay, and then you go down the sides of your fingers. Then you're going to want to do the side of your hand, don't do your thumb yet, 10 times. And then you go to your thumb. Then you move to the base of your hand. You want to do that 10 times as well. And then move to the back of your hand. And then once you've done the back of your hand, you're going to do your arm to your elbow, and you're going to do one side first and then move to the other side. And then you're going to move to the other hand and do the exact same thing. Start with your fingertips. And down the sides of each finger. You're going to do the side of your hand. And then go to your thumb. And then the base of your hand. And the back of your hand. Okay. And then you want to do your arm on one side 10 times. And then on the other side, wait, turn the water on for me. And then you want to rinse starting with your fingertips. And then work your way down. Start with one hand. You'll start this way. Letting it all drip to your elbows. And then do the same thing with this hand. Letting it all drip to your elbows. And then you will unfold your towel. And start with your fingers and dry them really well. And then you will want to open up your gown. You'll slide both arms in, and do not go all the way through the sleeves. Wait, I'm in. Okay, and then you're going to unfold your gloves and put them on. And when putting them on, to make sure that get the glove over the sleeve just slightly, and do the other one. And then you will pull down the ends of your glove, tucking your gown in. And then you are ready to go to surgery. This, didn't check the number, is how you properly organize the surgical tray. Looks great.
How do you get this thing to come back on?
I didn't. Just tap the screen.
Okay.
Get your 4x4 and you can block whenever she gets enough going down there.
Go ahead. So how long do you have to?
So you tell me.
Yeah.
So the duties for a sterile technician, you want to make sure that everybody and everything stays sterile through the whole procedure. You do not want anybody coming in that is non-sterile into the surgical suite during your surgery time. Another job is to hand the surgeon the instruments. You always want to hand the scalpel blade with the handle towards the surgeon, or if you have handled instruments, you need to make sure that the handles are down when you're handing them to them. If an instrument becomes unsterile during a procedure, the quickest way to recover and get the instrument back is doing a flash sterilization, which roughly takes about 5 minutes. Okay, so we're going to tie in our patient to make sure she doesn't get off the table or go anywhere. And that way the limbs don't get in the way for the doctor. You're going to be very careful not to contaminate any of your surgical site. These are just strings, rope leads to tie the cat down. Next, we will hook her to our ECG monitor, which shows her heart rate and how well she is breathing. Walking here. Okay, so now we're going to tie him in so that he doesn't leave. Go. Ah, he is a mitten kitten. Cool. Want to make sure your area stays aseptic so that it stays clean. Then you will apply eyelid, because if not, they will get corneal ulcers. Okay, so Dr. Lindley is doing a neuter on a cat, and I will assist by making sure the cat's vital signs are good. And we've got him hooked to oxygen and gas, the isoflurane, so that he goes to sleep a little more because he is slightly awake. Dr. Lindley is doing a neuter on a 6-pound puppy. He's 14 weeks old. We did his anesthesia induction. We're monitoring with our ECG and SpO2 monitor, and then we will have direct contact with him, and we will monitor his temperature every 15 minutes and his heart rate every 5. Okay, I'm here with my preceptor, Jessica, and Dr. Lindley. She's doing a spay on a dog. We are monitoring her vitals. We have direct contact, and we have her ECG monitor and SpO2 monitor on her. We're going to check her vitals every 5 minutes and her temperature every 15 minutes. Okay, this is how to properly dispose of a surgical pack once it's been used. You're going to make sure that all of your tools are still there. There should be 11 tools, a scalpel blade, suture material, stapler, and then our gauze. There's usually like 6 to 9 pieces in each. So first we're going to get rid of the scalpel blade. Okay. You insert it in here. You wait for the click, and then pull out, and that's how you dispose of that. Sideways so it'll fit up there. And then our suture material goes into a canister where we put all of our needles and suture material. And then the rest of the pack will come in here. And then all the instruments go into the sink whether the doctor uses them or not. And then we have an antibacterial foaming spray that we spray on them. We just want to spray it on there really well. Let it sit for about 5 to 10 minutes, and then you scrub it in hot water with our cleaning brush here. And then all of our instruments go into a shaker for 20 minutes, and then they are ready to be autoclaved. The surgeon is finished with the surgical suite. You need to clean it. You need to clean everything that was used. Even if it wasn't used, go ahead and clean it. Make sure to carry out the trash after every surgery and wipe down all of the equipment. You want to make sure that you have a specific set of cleaner in the surgery suite and do not take it anywhere else. That way it stays in the surgery suite and you're not bringing in something else. You'll want to wipe down everything, the tables, the trays that they use, the anesthetic machine, everything, even the floors. That way you minimize the dust in the room and the bacteria. How to properly wrap an instrument pack. You're going to want to fold your drape in accordion style, just like so. It will go in the middle of your cloth. You'll lay down 8 pieces of gauze, and then each spray pack has 11 tools. So, this way. Okay. And then, what you're going to do is fold the top half like that and then drape backwards. You want to make sure that you leave the pull tabs on all sides. Then you'll fold this side in and leave that. This side in, doing the same thing. That way when they open it, it's easier to get into the back. And then, it's like an envelope style is what you're going for. You'll fold in half and then tuck under and leave the pull tab for them to be able to pull on. And then, there we go. Then you will put it in your we have these sealer containers, or sleeves, to put it in. Seal it. And then on the other side, you will write what it is, the date, and your initials. Just like that, and then it's ready to go in the autoclave. This is how you properly wrap a surgical gown. So the easiest way, it's already ready to go. The easiest way is to lay it out on a table. You're going to want to bring the arms to the front of the gown. And then you're going to take each side of the gown and fold it towards the middle. About halfway is ideal. Okay, and then you're going to want to fold the whole thing in half, like so. And then one more time, fold it in half. Then you are going to want to fold it like you do your instrument packs in the accordion style fold. Ties at the top. Okay, then you will get your wrap for the gown. Going to sideways, and in the same manner, you're also going to want to include the towel for the doctor or the surgeon. Going to fold in half here, and then fold backwards to create a tail. Take both of the sides. The same manner. Take the top. Let's do it. Make sure that you leave a pull tab for them to open it with. And then you will take your indicator tape and wrap it completely. That way when you put it in your autoclave, you will know that you are getting a sterile gown. On the indicator tape, there are lines on here. When it goes through an autoclave, it will turn black once it has been done. Then you will put on here what you have. I'm putting the size on there too. You put the date and the initials of who packed it. And that is how you wrap a surgical gown. Autoclave. An autoclave works by the temperature rises and the pressure changes to make a penetrating steam that kills the bacteria that were left on the packs. Ours is pretty simple to use. You just close the door and then you select what you want and hit start. And then it will do its thing and release the door when it is done. And if you want to wait a few minutes to pull the surgical packs out of there because they are super hot. To pack an autoclave, we have 4 sets of trays here. The top one and the bottom one are the smaller trays, and then these fit our spay packs better. So when putting them in, you want to put everything face down, and then you do not want to overlap any of the instruments. That way it assures that the steam gets to every instrument. And then once it's ready to go, or you have all of your packs that you want to put in there, you'll just close the door, you'll hit your packs and hit start. Okay, so the temperature on an autoclave can go anywhere between 130 degrees Fahrenheit to 270 degrees Fahrenheit. So for our surgical packs, they go in at 250 degrees Fahrenheit. They run for 30 minutes, and the PSI for them is 15. How to maintain an autoclave? You need to make sure that everything stays wiped down, and then we have a foaming autoclave cleaning spray that we use. All of the trays come out. You'll spray this on the trays, let them sit for 15 minutes, and then wipe them down. And then you can put them back in. When you take out all the trays, you'll wipe down the inside of the walls of the autoclave. And then you want to make sure that you wipe this down. We wipe it down every day just to make sure that it is clean. The way to add and remove water for the autoclave, if it gets down below the red, or down to the red line, you need to add more water. But each week we empty out the water and change it out. So to empty out the water, you just unhook the hose here. And then let it drain into an empty container or a bucket, and then dispose of it properly. Then once you are done draining it, you'll dispose of that. You'll put your hose back in, and then to add water, you always want to use distilled water. You'll pour it into this little area here, and you want it to go up well into the green area. And then once it's well into the green area, you are ready to use it again. Okay, this is a spay pack that we just did. The way to tell if it is sterile or not, there is a color changing indicator on each of these sleeves, and it'll turn brown when the pack is sterile. And that 9.1, how to properly, remove a suture or a staple. In this case, he has staples. What you want to do is hold the patient to where they will not wiggle around a lot. And you will go in and gently remove the staple. His incision site looks good, but I do not think it's ready to come out just yet. So we will let those stay in for a few more days. But a way to tell whether, a way to tell whether it's bothering him or they need to come out. The skin will be really red and irritated, or they're going to lick it raw. But generally, if you give it 7 to 10, 14 days, they usually are ready to come out. We'll edit that part out. They're usually ready to come out. If you have sutures, it's easier to get little hemostats and tiny scissors and clip them out that way.